Hello, I'm Jamie Lauder from the Courtyard Clinic, and I had a question today about anti-inflammatories. So a patient who'd hurt their back a couple of days ago asked me, should they be taking anti-inflammatories on a regular basis to make it heal quicker? Now, before we answer a question about anti-inflammatories, we need to understand what the anti-inflammatories are doing. We need to understand a little bit about inflammation. Now, inflammation is what happens in the body in response to any injury. As soon as there's any injury to a tissue in the body, the tissue releases some chemicals that cause the blood vessels in the area to dilate, and the dilation gets more blood into the area, so all the nutrients that the body needs to heal get into the area to allow that healing process. With any injury, you also get kind of waste and some bleeding and things like that, so the dilation of the blood vessels helps to kind of take away kind of any of those damaged tissues and the waste and debris of kind of the healing process. But another thing that it does is where you get the dilation of the blood vessels, it causes kind of some fluid leaking and some swelling. Now, whilst this is an unpleasant sensation, it's obviously painful and it can cause like that throbbing sensation as you're aware of kind of your pulse in the area. It also acts as a little bit of an airbag, so the swelling in the area protects those damaged tissues whilst they're healing. So whilst inflammation can be an unpleasant sensation, it's also an important part of the healing process. And there's been some studies recently that have trialled anti-inflammatories in the treatment of sports injuries, and they've compared groups of athletes recovering from sports injuries taking anti-inflammatory medications and those that aren't taking anti-inflammatory medications, and they've actually found that the people that aren't taking them are getting better quicker. Now, I'm not going to say don't take any anti-inflammatory medications, because if something's hurting, you know, especially kind of when you're going to bed, you want to get to sleep. Sleeping's the time when your body does most of its healing. So you really kind of want to be able to get a good night's sleep. But the important thing to do is to remember that that inflammation is part of the healing process, and whenever you're turning that off, you're slowing down that healing process. And also remember that a pain is kind of an important thing too. Pain is your body saying to you, stop doing that, you're causing damage. So only take them as necessary. Always follow the instructions on the packet and the advice of the pharmacist and the doctor and people that kind of understand these medications. But essentially, don't take anything unless you really need to. And that's it for now.